What if the world's cheapest pill factory decided it was done making cheap pills? That's exactly what's happening. And it's moving faster than most people realize. For decades, India was the world's pharmacy. Not for cutting-edge science, but for generics. Copies of branded medicines whose patents had expired. Think of it like being the best photocopy shop in town. Reliable, cheap, always busy. The problem? Everyone else can run a photocopy shop too. And when everyone's doing it, your margins stay razor thin forever. So now, Indian Pharma is rewriting its own prescription. In 2024, Indian pharma companies struck roughly 61 deals worth $4 billion. That's basically one deal every 6 days. And in just the first 9 months of 2025, another 41 deals worth $2.7 billion landed. That's not a coincidence. That's a deliberate, industry-wide strategy shift. So what are they actually buying? Not more generic factories. They're moving into specialty drugs. Medicines targeting complex, specific conditions. Biologics, which are drugs made from living cells, not chemicals. Think insulin or cancer therapies and chronic therapies in cardiac care and oncology. These aren't photocopies anymore. These are original manuscripts. And original manuscripts command premium prices. Now, zoom out for a second. Medicine spending in India is projected to grow at 9 to 12% annually through 2030, with the country eyeing a spot in the global top 10 pharma markets. That's a massive runway. But here's the twist that makes this really interesting. The top 5 Indian pharma companies combined control only about 22% of the market. The remaining 78% is scattered across hundreds of smaller players. Sound familiar? It's basically India's restaurant scene. Thousands of local spots, but no single chain running the whole game nationally. That extreme fragmentation? It's actually an opportunity hiding in plain sight because consolidation has barely even started. Indian pharma is graduating from generic factory to high-value global player. And up next, we're going to look at exactly where these deals are going and what India is specifically targeting abroad. So the shift is happening. But who's actually cashing in? Because the winners here aren't random, and one of them is hiding in plain sight. Let's start with the obvious ones. Sun Pharma, Dr. Reddy's Cipla. These guys are doing what you'd call bolt-on acquisitions. Small, surgical buyouts that hand them R and AMP-D pipelines and direct access to markets like the US and Europe, without building from scratch. Think of it like a local clothing brand buying a boutique in Milan. Suddenly you've got the address, the clientele, the design credibility. All at once. That's the play. Now, the one most people completely sleep on? CDMOs. Contract development and manufacturing organizations. Basically, the companies that quietly make drugs for other pharma brands around the world. Divi's Laboratories, Loris Labs, Newland Labs. These are the quiet giants. And right now, global pharma is actively trying to reduce its dependence on China for manufacturing. So where are they looking? India. And here's India's actual secret weapon. R and AMP-D in clinical trials here cost 40 to 60% less than in developed nations. That's not a rounding error. That's a structural cost advantage baked into the geography itself. So CDMO order books are swelling, margins are expanding, and these companies are becoming critical links in the global medicine supply chain. Beyond the big names, even private equity and founders of mid-sized niche pharma businesses. Say, a specialty API manufacturer, that's the core chemical inside any drug, are suddenly sitting on very attractive assets. Consolidation is accelerating, and that creates real exit opportunities through IPOs or strategic sales. The bottom line. The value isn't just flowing to the headline companies. The entire ecosystem is getting re-rated. And up next, we're going to look at what the risks actually look like. Because this story isn't all clean margins and easy wins. So the deals are happening, the money is moving. But where does this actually go from here? Let's talk about what to watch, what could go wrong, and where the real opportunities are hiding. The big trend to keep your eyes on is OFDI. Outward Foreign Direct Investment. Think of it like a local restaurant chain buying a fancy foreign restaurant. You get new recipes, new customers, serious credibility. But you also inherit their expensive kitchen and their staff drama. That's exactly what Indian pharma faces with cross-border acquisitions. Integration costs, foreign regulatory compliance, cultural mismatches. Our infographic breaks down exactly where those OFDI risks cluster. And it is not pretty if you fumble the execution. One bad integration and that acquisition goes from strategic masterstroke to very expensive lesson, very fast. Then there's this slow-burning policy tension that doesn't get enough airtime. Data exclusivity versus generic competition. Here's the simplest way I can put it. Data exclusivity is like making every student write original exam answers, protecting whoever did the hard work first. Generic competition is like saying, okay, after a set period, everyone can reference those answers. As India pushes deeper into innovation, there's going to be real pressure to strengthen data exclusivity protections, which could actually slow down the cheap generics that built India's entire global reputation. That is a genuine policy tightrope, and someone is going to have to walk it. Now, the macro picture? Still pretty compelling. Medicine spending growing at 9 to 12% annually through 2030, India's manufacturing cost advantage still intact, and remember that fragmented market. 78% not controlled by the top 5. Means hundreds of acquisition targets still sitting at reasonable valuations. And if you're adjacent to pharma, logistics, packaging, lab equipment, healthcare services. This consolidation wave creates real downstream opportunities for you too. The bottom line is this: the transformation from generic factory to innovation hub is already underway. The deals are signed. Now comes the harder part: actually making them work. Follow us for more updates like this. Thanks for watching. And don't forget to follow us on YouTube, Instagram, and X.